Perinatal depression is a combined experience of both antenatal depression and postnatal depression. Antenatal depression is experienced during pregnancy and affects 9% of women. However, this carries on to postnatal depression, which affects almost 16% of women and is assessed on a timeline of when a child is 1 month old to 12 months old. While this is a health issue that affects women worldwide, an area which needs attention drawn to it is perinatal depression in rural areas and remote communities. In modern day media, we see a lot of anti-drinking and drug promotion surrounding maternity, but little to no acknowledgement of where these actions stem from, which is likely to be depression or mental health related. Factors such as education and employment opportunities, income and access to health services create disparity in levels of health between rural and remote to metro areas. The best way we can help women who are suffering perinatal depression is to have conversations about it and to break down this negative stigma attached to depression and mental health, not only for the woman but for the child and for those surrounding her.
First key step for mothers dealing with perinatal depression is to acknowledge that something is wrong. Perinatal depression is different from baby blues. Mothers will experience baby blues between 3 to 10 days after pregnancy and usually recover through family support and care. However, if feelings of sadness and distress continue, it could be perinatal depression. Symptoms of perinatal depression include feelings of inadequacy, guilt and sadness, low mood and or feeling numb, often feeling close to tears, fear for the baby and or fear of being alone with the baby, and feeling angry, irritable and resentful, especially towards your other children or your partner. For rural and remote places, there are limited services available for mental health, and even more limiting for maternal mental health. However, there is a growing demand for more available and accessible rural and remote mental health services. For specific rural and remote groups, such as Indigenous mothers, there needs to be culturally appropriate services and community engagement.
Raising awareness of perinatal depression is essential for increasing services and care available to those experiencing the issue, especially in remote areas. By just talking about the issue, we can all work together in decreasing the stigma and feelings of discomfort we experience when we talk about depression. A national helpline available to all is PANDA. PANDA stands for Perinatal Anxiety and Depression Awareness. If you need help in finding or seeking services, or would like to talk about any issues you're experiencing, call PANDA on 1300 726 306. Visit panda.org.au and do your bit. You can donate, volunteer or fundraise to raise awareness on the issue of perinatal depression, because we all matter.